Welcome to Health Matters on Samarama TV. And today we'll be looking at a Breast Cancer Awareness Month, and to October always being the month that folks, particularly ladies, take the opportunity to create the awareness of breast cancer. And breast cancer has become one of the issues when it comes to health matters. And so today we have Dr. Dorothy Hans, she's also a doctor at the Iman Hospital. She's here. She'll be telling us more on the Breast Cancer Awareness Month and what breast cancer is all about. So how is the Iman doing?
Iman is doing well. We are doing well, steadily. We are getting the awareness bit by bit, and we are giving people the quality service we came to do.
Oh, okay. What is Iman all about?
Okay, so Iman was set up as a private tertiary hospital. In that it's a one-stop shop for everybody who gets in there. IMA provides services for from children to adults. IMA provides radiological services. We provide X-ray, CT scan, MRI, mammograms with immediate reports. We also have a well-furnished pharmacy. Every drug you need, you'll get. We have a laboratory. We have a dialysis center, so people come in for their dialysis sessions. We have a physiotherapy unit. So physiotherapy goes on for both those who need rehabilitation and all sorts of physiotherapy needs. IMA also has a very ultra-modern morgue, I should say. You wouldn't know you're in a morgue when you get into our morgue. Our facility is state-of-the-art. I think everybody should come and have a feel of the services we have available, I should say.
Okay. All right. So tell us, what are the commonest illness that is being patronized at the IMA OPD?
I think currently this year has been peculiar because of the pandemic. So this year it's been more of the non-communicable diseases, being hypertension and diabetes, and people coming for their refills. We've had a few, I should say, COVID cases that we've had to manage and discharge them successfully home, which we are very proud of. We've had quite a number of heart-related conditions. Interestingly, this year, I think everybody is doing their precautions as we expect them to do. So we've not had a lot of respiratory tract infections, especially in the children, and people's immunities are being boosted up. People are covering their coughs, so it's not spreading as widely as it used to do previously. So yeah, I think it's just been the hypertension, the diabetes, and a few abdominal conditions basically. But of course, pregnancy and delivery is an all-year-round affair, so that one is also going on.
Talking to Dr. Dorothy Hans, she's telling us more on the Iman Hospital, what they do. Breast cancer has become one of the issues when it comes to the health complication issues. When it's like global issue that people are also crying out for. So every October is being used as the awareness month to make people to understand that breast cancer is still with us. So once breast cancer is still with us, I think once we go throughout the circle, there's the need for us to take a very, very serious precaution against this breast cancer. But I'll tell you, subscribe, like, and then share. And your comments are always welcome on the Samarama TV. Doc, let me understand, when they say breast cancer, what is it?
Okay, so breast cancer is cancer of the breast. The breast has various parts. There's the fatty part, then there's the part that makes the milk, and then there's the part that delivers the milk. So there's a lobular part, there's a glandular part, and then there's the fatty tissue. Breast cancer mostly forms in the functional part, the part that forms the milk. When we say cancer, generally, what we mean is normally cells are supposed to grow and die. God has coded every cell to grow and die. Even we human beings, we grow and die. But the cancerous cell loses the impulse to die. So it continuously grows and becomes a lump. So this lump further grows and multiplies. Some of them are bad. They are the ones that are called malignant. Some will just stay where they are. They are benign. They don't spread. So there are two types of cancers: benign ones which don't spread, and the malignant ones which are very aggressive. They spread through your bloodstream, through your lymphatics. Before you know, a cancer that started in your breast is now in a bone somewhere in your leg. You wonder how it got there. It just went through the bloodstream. So basically, that's what we mean by cancers. So breast cancer is a cancer that happens in the breast. It starts with small changes, some changes that your finger can pick, some changes that you have to do a radiological investigation to pick up. So I think I'll just keep it as simple as that. Yeah.
Okay. So tell us, what are some of the things or signs that you have to see that you have breast cancer?
Breast cancer will be picked up by anybody who frequently examines their breast. Any change you see on your breast, it should be an alert for you to take further steps to investigate what it may be. Some of the commonest changes you see include a skin change. I'll start from outside inwards. So it could start from a nipple discharge that could be bloody, or a color that is not milky. You should have it investigated. You could see some redness on any side of the breast. Sometimes the skin of that side of the breast pulls in, or you can obviously see a protrusion on that side of the breast. So a change in the size of the breast could be an indication that something might be going on in the breast. A lump, a presence of a lump in your breast could be an indication of a breast cancer. A sudden thickening on one side other than the rest of the breast could be just the sign of the early changes. In addition to the breast, you must look out for the part of the breast that's just below the collarbone, I should say, or there's breast tissue all over here to the actual hanging part. Then you should also take note of your armpits. There are lymph nodes. They are the structures that God put in your body to give you a sign that there's a change in some part of the body. The lymph nodes to the breasts are in the armpit. So sometimes those things even swell before you can pick the lump in your breast. So you should also examine your breast, your armpit, I should say, for changes like a lump. So if you notice a lump in your breast, in your armpit, you should have it examined. Maybe that's the only sign that there's an early change in your breast. All females should examine their breast, really.
So how do you examine your breast?
Wow.
How do you do that?
Examining your breast, you can do it in the shower, you can do it lying down, you can do it sitting up. Ideally, you should do it every month, at least the second to third day after your menses. It doesn't mean that if your menses are stopped, you stop. You can schedule a monthly examination, because the earlier you pick it, the better it will be for you. So to examine your breasts, first you should sit in front of a mirror so you can see what changes are going on. You sit in front of the mirror bare-chested, or should I say bare-breasted, so you can see your breasts. Then you can tell which is bigger than the other by yourself. Then you raise your hands all the way up like I'm doing. When you do that, the breast moves. Then you can see if any part is being pulled in or there's any change in shape as you go up. And you gradually come down again. Then by doing that, you can see if any lump will be more obvious by your up and down movement. Other people will suggest that you hold your waist like I've done and lean forward. See whether you can see any new lump or not, and come back. All this, you are sitting in front of the mirror, so you can see the changes your breast is going through. Then you oil your hands or your chest with any oily substance. The more slippery it is, the better you will feel. And in a circular motion, you move from under your collarbone all the way down to your breast in a circular motion like I'm doing. So you go around your breast, every part of your breast, the edges of it, the tissue of it, all the way back to the darker portion, the areola. When you get there, you take your time and once again examine, press it against your chest. By doing so with the slippery hands, if there's any lump between your arm, oh, I should have said this before, forgive me. Ideally, you use the flat of your palm, not the tips of your palm. Use the flat of your palm so that you don't miss any lump. If you go pressing this way, you might miss a lump. However, if you use the flat, you get a bigger area and you can pick up any new change as you go around in your circular motion. All right. So when you get to your nipple area, once again, you go around the whole breast. So you can do this seated or lying down, however comfortable you are. Some people prefer to lie down. You can chuck your hand behind your head, just lie down and go around it everywhere. Like I said, after examining your breast, you should examine your armpit. So whilst lying down, while seated up, you put your hand, your slippery arms, also once again, all over the whole armpit area. So you can pick up any new lumps or any new changes that may have come there. You should also press the breast for any discharge. It's not pressing the nipple. You won't get any discharge from there. You start from where the skin changes from normal skin to the darker skin. So you squeeze the breast out. So by doing that, you can elicit whether there's a discharge or not. A nipple discharge that is bloody is a cause for urgent attention. Any other color that comes, you should still go, because it could be related to your hormonal cycle, or it could be related to a drug you're on, or it could just be the beginning of a breast cancer that is we can't palpate yet. So by examining, if you find nothing, we thank God. If you find any new thing, you should start looking forward to trying to have it investigated, really.
All right. You're still watching Samarama TV. Health Matters is the program we're looking at breast cancer, and this month is a breast cancer awareness month. Globally, this month is being cited for this awareness month, and they create the awareness for folks to understand, particularly our ladies, women, mothers, and sisters. Doc, let me understand one thing, because people feel that, oh, okay, this is breast, so men are not involved. So how? Because men don't have breast, we have chest.
Oh.
So what role do we play?
Interestingly, men have breasts, but yours is not developed. Ours is developed. So some men can also get breast cancer, I should say, but it's not as common as it is in females. Men get breast cancer too, so you should also check your chest, see if there's any new lump in your chest, your undeveloped.
Okay.
And men should actually get involved, because we all essentially came from our mothers, and we all have female associations, be it our sisters or our girlfriends. We are associated with females. It shouldn't be a burden of only females because we have the breast. If something affects a woman, it affects a man indirectly. So all men should get involved too. Whilst we are advocating for ladies to get their breast screened, men should also encourage their female counterparts to get it screened. If you can learn how to do it for your partner, so be it. It will also help with the bonding.
It's not only the evenings, but
no.
Or the nights. You should also
we appreciate the special attachment you have for the organ, I should say.
Special attachment.
Yeah.
Especially the men have special attachment for this. But what is the risk factor when it comes to breast cancer?
The risk factors are many. Truly speaking, the more your risk factors are, the greater the chance of you getting breast cancer. It's a non-communicable disease, just like diabetes and hypertension. So it's more of a lifestyle-related thing. Thankfully, this year, COVID has gotten all of us to modify our lifestyles a bit. Everybody is eating better, exercising better, cutting down alcohol. We've changed a bit, and this will all help us keep down some of these non-communicable diseases. For breast cancer, the genetic factors are a common risk factor. There's a gene that actually runs through families. If you have a sister, a mother, or a daughter getting breast cancer, you could also get breast cancer. And being female is a risk factor for breast cancer. We have it more than males do. Also, if you have your menses early, if your first menses, we call it menarche, your very first menses starts before 12, your chance of getting breast cancer later in life is higher. For women whose menopause also delays till beyond 55 years, their risk of breast cancer is higher. Also, females who don't have their first child early, as early as, if your first child is after 30, your risk of breast cancer is higher. People who are on hormonal therapy and oral contraceptives have an increased risk of breast cancer whilst they are on the therapy. But this increased risk gets back to a normal person who is not on it within 5 years of you stopping the contraceptive use. So I would use this opportunity to advise people to use it with caution. It's not for daily use, it's for a purpose. Another risk factor is contraceptives, hormonal replacement therapy for women who are postmenopausal, and then for women who are also trying to control birth, and those who are using it for other purposes, I should say. Whilst you're on the hormonal therapy, your risk of getting a breast cancer is high. But once you stop, like I said, once you stop, within 5 years of stopping, your risk factor comes back to a normal person who has not been on hormonal replacement therapy or contraceptives. So I'll say people should use these medications with caution. Don't just take it routinely as you are taking it to prevent something that you are actually not engaged in. Get actual counseling before you get onto it, because by that, the person who put you on it will be monitoring, knowing these risk factors are actually possible, so that if there are any changes, they can pick it early and then do something about it for you. Also, being obese also puts you at risk of getting breast cancer. Excessive alcohol intake in females increases your risk of breast cancer. The more you take, the higher your risk of breast cancer. And then smoking cuts across all the cancers. Once you smoke, your risk of breast cancer is higher. Things that will protect you are physical activity, keeping a healthy diet, breastfeeding. Women who breastfeed are actually protected from getting breast cancer.
So what will you, we know that breastfeeding is for 2 years.
Yes.
But people cut it short.
The stresses of life.
This
Formula
artificial
milk.
formula milk and
Yes.
other things.
For some women, it's easier because breastfeeding is a commitment you make to your child, and it's a good commitment you make to your child because what the baby will get from the breast milk, the formula milk cannot compare. Even though we are all looking for weight gain, there are other benefits that breast milk has that formula milk will not give. Breast milk will give weight gain plus more. What you need for your baby's brain development, his immunity, and all that, you won't get in the formula milk. So I would encourage women to breastfeed as much as you can. Aim for the 2-year period. If you have to go to work, find a way. Breast milk, I think we'll do breast milk later. You can express breast milk and store, keep breastfeeding while you're away at work. You can keep the stores going till the 2-year time. It's possible. Okay. It's doable. We'll talk about it.
We'll talk about it. then maybe we'll come to IMA and then talk about it.
Yes.
I know IMA is offering free screening.
Yes.
What is into it?
So this month, this is October Breast Cancer Awareness Month. IMA is offering free breast screening on Wednesdays, Fridays, and Saturdays between 10 a.m. to 4 p.m. Because of the pandemic, you have to book so we can make preparations and arrangements for you. The number to call is 054 7494 254. 054 7494 254. You call, you book, you just take a few details, you tell them when you're showing up, arrangement is made for you, and you come for a free screen. In addition to that, if they find any new changes in your breast, the cost of ultrasound, mammogram, and even biopsy is when they take part of the breast lump they found to check whether it is cancerous, bad cancer or good cancer. Even that has been slashed by 40%. The ultrasound will be done for you at 40% discount, mammogram at 40% discount, and then the biopsy at 40% discount. So come screen with us, get the full benefits, get an end to a diagnosis, and be happy.
Be happy. Finally, what will you tell women out there, men and women out there, when it comes to Breast Cancer Month this October?
This October, get screened, I should say. Early detection saves lives. For cancers, once you find it early, then the chances of doing something good that will improve your quality of life and even your life expectancy is better. So get screened and don't just use October. Even after October, have an awareness for checking your breast throughout the year.
All right, that's Dr. Dorothy Hans. She's a doctor at the Iman Hospital at the Community Free. Yeah, that's where it is located. So they are giving free screening, so why not join them this October? And I hope you join them. My name is Sharif, and until we'll come your way with another health issues, we'll be talking about breast milk and other things. So watch us, and we'll be coming your way with more. Thank you so much. Bye bye for now.